Primary survey is used when the victim is unconscious and to find out and immediately treat life-threatening conditions. A. Check for consciousness. Ask the victim, "Hey, are you okay?" while carefully shaking the victim's shoulder. When there is no response, not even mumbles or groans, the victim is unconscious and in need of immediate medical help. B. Open the airway. The victim's unconsciousness may be due to an obstruction of his or her airway. Find out if there is a loss of muscular control in the throat area, which allow the tongue to slip back and block the throat. Lift the chin and tilt the head of the victim. If the victim is an adult, this way will be able to lift the tongue from the back of the throat, leaving the airway clear. C. Check for breathing. Put your face near the victim's mouth and look, listen, and feel for breathing. You should observe for chest movement, sound of breathing, or feel of breath on your cheek. D. Check for circulation. Locate pulse using your middle and index finger. Pulse indicates blood circulation, which is essential for the heart and brain to function. Poor blood circulation may be reflected on the pale color of the skin. This is fatal. To revive circulation, perform CPR immediately. Secondary survey is used when the victim is conscious or has revived. It aims to detect everything about the patient's condition. A. History taking. Sample pain is the mnemonic in order to perform the steps more easily. Symptoms. The chief complaint of the patient. Allergy. Find out if the victim is allergic to anything. Medication. What are the medicines she or he is currently taking? Previous illness. That may be related to the problem. Last meal. Only for those subject for operation. Events prior to what happened. Period of pain. How long? What started it? Area. Where is the pain coming from? Intensity. Nullify. What stopped it? B. Checking for vital signs. A. Pulse rate. Use fingertips in getting the pulse. Follow the following procedure. Number 1. Place the fingertip over an artery where it either crosses a bone or lies close to the skin. Number 2. Feel the pulsations as the pressure wave of blood causes the vessel wall to expand. That is the pulse. The pulse rate may be taken in different points in the body like brachial, carotid, wrist, temporal, subclavian, axillary, and femoral. Normal pulse rate, men 60 to 70, women 70 to 80, children over 7 years old 80 to 90, children over 1 to 7 years old 80 to 120, infants 110 to 130. B. Temperature. It is important to monitor temperature in the case of stroke and high fever. Body temperature is measured by using a thermometer within the rectum, rectal, oral, mouth, and axillary armpit. C. Respiration. Count the number of breaths per minute. A whistle sound or wheeze and difficulty in breathing may mean an asthma attack. A gurgling or snoring noise and difficulty in breathing may mean the tongue, mucus, or something else is stuck in the throat and does not let air to get through. Between 15 to 20 breaths per minute are normal for adults and older children. 40 breaths per minute are normal for babies. D. Skin color. Skin color reflects the circulation of blood and the saturation of oxygen in the blood. The presence of mucus around the mouth, inner eyelids, and nail beds is a sign of poor blood circulation. A healthy skin is warm and pink because of the blood flows normally in the blood vessels. C. Head to toe examination. Number 1. Head and neck. Are there any lacerations or contusions in the area? Is there a presence of blood in the victim's hair? If yes, immediately find out where it's coming from. Is there any fluid in the victim's nose and ears? If yes, the skull has a fracture. Number 2. Eyes. Pay attention to the pupils. Dilated pupils means state of shock. Very small pupils means poison or use of prohibited drugs. Different sides means head injury that requires immediate attention. Small and bright means pupils are reactive. No reaction means death. Number 3. Chest. Check for cuts, bruises, penetrations, and other impairments. If the victim feels pain when you apply pressure into his or her chest, there could be a rib fracture. Number 4. Abdomen. Does the victim's abdomen hurt and tender? Where is the pain coming from? Did the victim feel any lumps? If yes, get immediate medical assistance. Number 5. Back. Is there any movement in the victim's lower extremities? Is there a sensation in these parts? If yes, do not move the victim. Immobilize him or her.